Thank you very much for this opportunity to be with you all, and particularly the topic therapeutic education. Therapeutic education is not just the patient education, because in patient education, what we do is we educate the patient or impart knowledge about the illness. But therapeutic education is more wider, deeper, dynamic, and lifelong learning process. It covers not only the knowledge about the disease, but it includes knowledge about the treatment and the capacity to cope up with the illness. To manage the disease, we need to bring about change in behavior. Knowledge will not change the behavior. Providing oral, written information and advice about prevention is not therapeutic patient education. The principles of therapeutic education is actually based on a complex neuroscience. The behavior is viewed as a communication, emotional, sensory, and physical needs. I'll give you an example. See, Srikanth is a type 1 child. Came to me about 10 years back. He was a very intelligent and very cheerful child in spite of high sugars. Only the parents were very much distressed. After addressing the parents and initiation of insulin, the child was asked, which one you prefer? Whether the chips, pastries, aerated drinks, is it good for health? Immediately he says, it's all not good for health. Vegetables and fruits are only good for health. Okay, if I give you both, which one you will choose? Immediately he says, I'll choose only chips, pastries and aerated drinks because I like it. So the knowledge will not change the behavior. So what is needed is to change the behavior, attitude should change. So keeping sugar under control is an achievement. To achieve this, he need to adopt certain behavior. The accomplishment should give him happiness. Then only the behavior will change. Being the child, a very disciplined child and with the dedicated patient's care, he could grow very well. The next few years were very smooth. But after few years, the parents come with the child very anxious, and the mother has lot to complain about the child, telling nowadays he is not obeying me, is even refuses insulin injection, takes too much of sugar outside and all. And the child also looks adamant. Okay, now he is no more a child. It's an adolescent age. Adolescent age is a crucial period because the child loses the privilege of the childhood as well as the reverence of the adult also is denied. So it's a age where he seeks more information, needs definite solution, decision making. So what he needs is self-care skills, relieving symptoms, taking into account self-monitoring, self-measurement results, adjusting dose of medicines, initiating self-treatment, accomplishing technical and healthcare procedures, implementing lifestyle changes, diet, exercise, preventing avoidable complications, facing up to disease-related problems, involving close relatives and friends in the disease management, and in any repercussions, how to manage that. So, what is to be done in one line? The child is no more a child now, adolescent. We should make him to take responsible of his health. Now comes the early adulthood. It's a period to choose the career, cope up with the new environment and people. Coping skill is very important. Personal and interpersonal, cognitive and physical skills that enable people to control and direct their lives and to acquire the ability to live and modify their environment. They are based on the patient's past and previous experience and are part of a larger set of psychosocial skills. Now we will see how Srikanth's early adulthood is. After completing plus 2, his father puts him in a college, but within a week he returns back telling the hostel food he didn't like. Okay, after 2 or 3 months, again he was put into a polytechnic college which is in its local place, and he comes back within 2 months because he was not feeling well and he didn't like the course and so on. After wasting one academic year spending time on gym and Google searching for alternate therapy, trying all protein food, somehow he wasted 1 year, and now again the father with all his efforts tries to find a very good college. Now he comes back with pain abdomen and vomiting. This time father himself says, even if he doesn't study, it's okay, I want him to be alive. Now the father needs counseling. Being alive is not living. As my professor used to say, every diabetic patient should be helped to live his normal span of life in perfect health. Perfect health is physical, mental, as well as social. So, what Srikanth needs now is life skills, self awareness, self confidence, managing emotions, controlling stress, developing creative reasoning and critical thinking, developing communication, interpersonal skills, decision making, problem solving, setting goals, and making choices. It all may sound very complex sentences, but you are all doing it for your patients. All good diabetologists, good practitioners are doing it. What we did for Srikanth is we entrusted a staff who is also a diabetic patient, completed MSc in nutrition and a very good therapist by nature, to solve his problem and to find out what makes him unhappy in the college. Then we presented a book written by Dr. Mook and the Banting Bows and Beyond, and we called another type 1 boy who completed ME and working as a faculty, introduced to Srikanth, and we asked him to guide him. So within few weeks he recovered and went back to college. Now he is a very happy youth and the parents are proud. Okay. Now another 4-5 years, the time for marriage will come. Marriage is a stressful situation for boys. However, it may be a period of excitation and expectation for girls. Now Srikanth will need lot of psychological support. Who will provide this? Is there any therapeutic education facility available in India? Therapeutic facility and therapeutic education, not only for chronic illness like diabetes, heart failure, bronchial asthma, but also for drug addiction, prisoners, children education, workplace, and so on. The concept therapeutic education was started in 1922 with the initiation of insulin therapy, but after 1990 there was an exponential growth and it is there in every aspect of the field. Even someone has written a book called Dangerous Rise in Therapeutic Education. However, if someone wants to start a therapeutic facility, there is a guide, WHO guide. The purpose of this guide is to equip policymakers and health professionals to provide better access to effective therapeutic patient education for all patients. So there are different types of therapeutic patient education: initiation and reinforcement, recovery. These breakdowns are only schematic and all depends upon the patient's need and the past experience. So therapeutic patient education is a continuous process that requires permanent adaptations linked to the evolution of the disease and the experience of its management by the patient himself and to its own request. So what to know about therapeutic patient education? The goal of therapeutic education is to improve the patient's health, clinical, laboratory-wise, and the quality of life, both the patient and the relatives. Patient should acquire self-care skill and life skills. Therapeutic patient education must be individually tailored. These are based on the patient's previous real-life experience and form part of broader set of psychosocial skills. So to conclude, though therapeutic education is useful in all aspects of life, it's very much relevant to diabetes, because diabetes is not only a chronic illness, but it is dynamic, evolves into different phases. Effect of pharmacological therapy also varies, intra-individual and inter-individual variation is there. And there are situations when patients need to take decision regarding treatment like hypoglycemic episodes. So therapeutic patient education is very much needed and it should be a part of patient management. Thank you. Thank you, sir.